community of Rockland Ranch.
Hello, friends.
We are coming together because I'm doing a Bachelor of Science in Nursing class called the Community Assessment, and I have a requirement to do some educational content for a community, and I've chosen our own community. And I wanted to give us information about measles because measles is spreading across the United States, but also particularly in Utah, we've got a lot of measles in southeast, or excuse me,
West.
southwestern Utah, which are the counties neighboring us. So I wanted to give everyone some education guidance on measles. So we'll talk a little bit about the risks of measles, how measles is spread, the symptoms that you'll notice, how you can work to prevent it in your family, and what should we know as families in our community to help prevent measles and also to prevent spreading it if it does come in our community.
Yes.
Let's see, I gotta find my mouse. Here we go.
So, I know a lot of people feel nervous about measles. So, here's some facts. Measles is a virus. That means that antibiotics will not stop it. Um, and it's super contagious. So, if you are exposed and you're unimmunized or you've not totally had the disease, then there's a 90% or greater chance that you will get it. It is contagious by droplets and airborne. So that means if you're in a room with anybody with measles, you are exposed. Or even up to 2 hours after that person leaves the room
That's
or
right.
the home, or touching a surface, or even on anybody's hands or clothing.
That's right. So it's super contagious
Mm-hmm.
and very easy to contract without knowing it because you could walk through a room that someone has been in less than 2 hours ago that had measles and you've been exposed, which is very difficult.
So would masking help or not, do you think?
Masking does help.
But it's,
The appropriate mask is an N95. I think we're all familiar with what an
yeah.
N95 mask is now.
Mm-hmm.
Um, and if you know you don't haven't had measles in the past and you have not been vaccinated for measles and you're going to be in the near vicinity of someone with measles, like in the house or in a room, then I would highly recommend you wear an
Mm-hmm.
N95 mask that is properly fitting. Wash hands often. Be
Mm-hmm.
really careful.
Mm-hmm.
So I think it's my turn. The in Utah, the case data is that as of the 27th of this month, there are 486 confirmed cases of measles and that's between 2025 and 2026. So it's not 486 current cases, but 486 cases that have been since 2025. But that is not including unreported cases. Those are confirmed tested
Mm-hmm.
positive for measles cases. So you can imagine there's a much higher case count in Utah because there's a great deal of people who had exposure, started having symptoms, stayed home and away from other people, but also their case was not counted in the Utah case data.
So, for example, you could have one case that you know is measles, and then a family of 20
That's right.
other people that also have
Yeah. So
it.
that number of 486 confirmed cases um, represents many, many more people that have had measles in Utah between 2025 and 2026.
That's since the current outbreak started.
That's right.
Okay. So, in the very early stages of measles, you won't even know you have it. The early symptoms are fever, red watery eyes, irritated eyes, runny nose, and cough, just like a cold or a flu that's going around, and these go around often. One thing you can look for if you suspect it is on the inside of somebody's mouth and the inside of their cheek are these things called Koplik spots. It's red, small red irritations with a white center to it. Um, and there'll be just a few in the beginning, and then there'll be a lot of them. And these will also happen by what, day 3 or 4, or something like that, but before the rash.
That's right. And then as the rash begins to appear, it'll appear between approximately day 7 to 14 of your exposure date. So, and you'll notice that kind of start around the hairline and near the ears and then on the neck.
Behind, don't forget the back neck.
That's right, and
Yeah,
on the back of the neck.
yeah.
And then as it progresses, it'll move down your neck on your trunk. You'll see it on the arms, and it'll go clear down your legs. It'll be on your back. Um, and it will develop in a way that at first you'll have, red rash spots, and they'll kind of be here and there, and then they start to proliferate. You'll see more of them. You were saying they'll even kind of merge together
Hmm.
until you're quite covered in these spots.
Yeah, and very itchy.
Very itchy. That's right.
So you're contagious before you get the rash, maybe 4 or 5 days before the rash even shows up. And the thing that surprises me is then after the rash shows up, it's only maybe the first 4 days that you're contagious.
That's right.
So someone with a full bloomed rash, say on day 7, it's it's more okay to be around them.
That's right.
Um,
Their
you know,
contagious period is over, which doesn't doesn't seem very intelligible. You feel like if they're covered in the rash, you'd need to watch out. But after the
yeah,
fourth day of
mm,
the rash, then their
hmm,
contagious period is over.
right. Then they're not risking exposing anybody else
That's right.
who's not already been exposed when they were in the early stages of the
That's right.
disease. And most people would develop that rash within 7 to 14 days of exposure, but it can be up to 3 weeks, 21
21
days.
days. That's right.
Hmm.
Mhm. So, for isolation guidelines for family members, um, we just talked about, you need to isolate for 21 days after your last exposure, unless you are fully vaccinated, and fully vaccinated is 2 doses of the MMR, or you have had a confirmed case of measles. Um, and I just wanted to expand a little bit. It's important to think that the 21 days, if you're in a household and you haven't gotten it, and the person that has it in the family is on their fourth or fifth day of the rash, that um, fifth day is your day 0 of isolation, and then you do 21 days from there. If somebody else in your family starts to develop symptoms,
Hmm.
then your new day 0 begins on the after their contagious period, which is their fifth day of the rash, last rash in the household. That is your day 0. So you can imagine that it's likely, if it goes through a household, you have a very long period of isolation.
Yeah, that would be a mess. And isolation, that means Nobody goes in, nobody goes out of the home,
That's right.
except maybe in your yard where you have fresh air
Yeah.
and um, you can get some sunshine. That means you notify people, and we as a community can help by bringing food, um, getting what you need from the store, um, or things like that,
That's right.
so that um, so that we can get through it safely.
And help you care for you and your family if you do develop it. Then, like you said, we can help support the family members. For those who have had a confirmed case or are fully vaccinated, it is reasonable that they can come in and be in the household. I personally would still wear an N95
Mm,
mask and use good hand hygiene
hmm.
measures, and then maybe change my clothes even after I've been there. But because those people are considered immune, it would be safer for them to go in the house and care for you.
Right, but then that doesn't mean that an immune person wouldn't take it out of the
That's right.
house like you're
hmm
talking about.
So you change clothes,
Hmm.
you wash hands, you really be considerate of the fact that you might be immune, but you may also have it on your body and can transfer it to someone who's not immune.
And this is because of the airborne
hmm
contagiousness, right?
Yep, those
Hmm.
droplets can land on your clothing and they're still considered alive and able to infect someone for 2 hours after that period.
So most people will get through the measles just fine, can stay home and be uncomfortable, but some people will develop complications like ear infections, croup, diarrhea, pneumonia, and brain infection, which can lead to death. Croup, I want to talk a little bit about that because that's that sound that you may be familiar with, and it's inflammation in the airway of the throat. It's not down in the lungs, it's not wheezing, although they can get bronchiolitis
hmm
too, which would be the wheezing. Pneumonia would be wheezing or crackling or trouble breathing, but also that croupy sound means that their airway is swollen way up here, and that can be quite risky. Diarrhea, you can dehydrate, but you want to stay ahead of that with electrolytes, mild foods, and fluids. Pneumonia is a problem that, um, with a high fever, wheezing, trouble breathing, that's when that's dangerous and the person really better go in and be seen. Brain infection or encephalitis is marked by a high fever, terrible headache. Um, they may be kind of lethargic or out of it.
That's right. And it's essential that you go seek medical attention
Yeah,
as
that's
an emergency.
yeah, life-threatening emergency
hmm
if that happens.
That's right.
Um, Statistically, 1 out of 1,000 people who get measles uh, will die.
That's right. We're doing a video for about measles for the community.
Oh, was it recording?
Yes. And
All
here's
right, guys.
Tyler.
Okay, come find me after.
Thanks for
Okay.
that cameo,
Thanks for the.
Tom.
And there's Tom.
Yeah.
So, risks for pregnant moms. It is so important that we protect our mothers who are pregnant in the community or women who are of a childbearing age from being exposed to measles because they may have an early stage pregnancy that they're not aware of and be exposed to measles. The risk is it's dangerous for the mother because She's considered immune compromised when she's pregnant. Your body's immune system slows down to help protect the baby. And there can be risks to the mother, even to the point of fatality. But then there are risks to the unborn child. The unborn child or your fetus can be born with a low birth weight, a very premature delivery, which, as you know, results in NICU care. Um,
And possible lifelong complications to the
that's right.
baby.
Yeah, lifelong complications. The baby, the inborn child may actually die, resulting in that fetal death. And then if you if you're a pregnant mother and contract measles, you may actually deliver your baby and the baby may have an active case of measles as a
Hmm.
brand new newborn baby.
And that baby would have no immune system. That would be a NICU stay and a very touch and go situation that we hope we don't have.
That's right. Very dangerous for pregnant mommies.
Treatment. Okay. Mostly you can do it at home with Tylenol, fluids, and rest. Some people's eyes will be really, really irritated to where light bothers them. If so, then just be in the dark room, good airflow, uh, comfort measures. Calamine may help with that itchy rash, Tylenol for fever and discomfort. Um, an adult can take 2 extra strength Tylenol every 4 to 6 hours. A child, well, an adult would be kids down to age 12 or a good sized 12-year
Mm-hmm.
old can handle an adult dose. Smaller kids, it's dosed by weight. So you can see that on the package, or we know how to calculate that.
Mm-hmm.
But that can also be given every 4 to 6 hours safely with fluids, um, bed rest, and quiet activities. Maybe they want to read, or if their eyes are bothering them, maybe not. Maybe just listening to some soft music. Um, Screens would probably be irritating.
Yeah.
And
And then you might want to treat secondary infections.
oh yes, yeah.
So secondary infections might be like you've got this viral rash from measles that you're scratching, and you get a bacterial infection because you've broken the skin with scratching and got bacteria in there and develop an infection. That might look like increased redness, swelling, pus, um, maybe a foul odor. Um, you can even have a secondary infection in your lungs. Um, and those are good times to contact a clinic or the hospital and let them know that you're going to be coming in for treatment. As well as if you don't feel like you're able to stay hydrated while you're fevering and having diarrhea, you may need to go
Hmm.
in for um, some fluids to help hydrate you. Now,
Right, and that would be the person's not putting out much urine.
that's right.
Inside their mouth would be kind of sticky rather than wet.
Mm-hmm. Yep, dry lips.
Hmm.
Um, and it's important to remember if you are going to go to the clinic or the hospital, you need to call ahead. Let them know that you're coming and that you suspect that the person that they're treating has measles. And find out what the safe way to go into the clinic or the hospital would be so that you're not exposing other people in the waiting room or exposing other care providers.
Right.
So the MMR vaccine is the most effective way to prevent measles. The vaccine is 97% effective after you've received 2 doses.
those two doses need to be at least 2 months apart,
Hmm.
um, but can be longer apart. Um, and 2 weeks before any exposure,
That's
so
right.
that the body has a chance to develop antibodies. It's teaching the body to recognize the measles virus and to respond to it.
That's right. And so if you know that you're going to be in a area or a population that has a current outbreak, it and you think that you would go ahead and get the vaccine, it's important to plan ahead and
Hmm.
get it, um, ideally so that you would get the second dose 2 weeks before you travel.
Yeah. Hmm.
Um, and the normal vaccine schedule for MMR can be given, the first dose at 12 months and the second dose at, between 4 and 5 years of age. But if you've passed that time, you're an adult or a teenager, you can go ahead and, get that vaccine, um, without any complication.
Okay. Now, it used to be that the medical profession thought one dose of MMR was enough. So it's 1989 is around the time that they started to figure out no, that people with one dose are still starting to get a breakthrough case of measles. So they started recommending a second dose. So if you're born before 89 and did get vaccines, then check to see if you actually had two or not. Um, if you're unsure, you can consider getting a third one.
Yeah, and a third one is
It's
not
not
dangerous.
right, right. Or getting titers. And
That's
that's
right.
a blood test. Probably costs a little more than a
Hmm.
vaccine, but they can actually um, count the
You're
antibodies that
That's
you have
right.
in your blood.
Do kind of assess your immunity to see if you
Hmm.
might need that, additional dose.
Or if you want to isolate yourself preventively.
That's right. Okay, so, if you would like to get the vaccination, and you are insured, most insurance companies cover vaccinations at 100%. If you're unsure, you can call the number on the back of your insurance card and ask them what coverage you have for insurance. If you do not have insurance, Utah actually has a program called the VFC, or Vaccines for Children program, that provides vaccines that are free of cost to, children who are 18 years or younger. So if you're an adult or if you're 19 or older, you will have to self pay for those vaccines. If you're 18 and younger, you do qualify for the Vaccines for Children program if you're uninsured. I know that the San Juan Health Clinics do have the Vaccines for Children program available, and I recommend that you just give them a call, make sure that the vaccines that you're interested in, are available there, and see what time they'd like you to arrive for that.
And here we have a guest appearance.
Guest appearance. It's Nathan.
Handsome.
Wow. Too
Hello.
bad you aren't single. How
Hello.
you doing?
Good.
All right. Well, I'm going to leave you too, but I had an opportunity to come say hi to you. I had to scoot by this morning because I was the party, but now the
Hello.
party's over.
Oh,
So,
darn it. I know you are such a good teacher.
well, looks aren't everything, but it helps.
But it helps,
Yeah, I mean,
doesn't
if you
it?
got to stare at somebody for an hour, it might as well be pleasant to look at. But
That's
yeah,
right.
And
yeah.
engaging and able to really distill those spiritual principles because they're in you.
That's right.
Here's hoping. I'll take it. I'll take it. I'll need all the grace I can get. I love you. Yeah, I'll
Well,
see ya.
good Sabbath.
Say what?
Have a good day.
Yes,
Good.
I'll take it.
Okay.
Yeah. I love this. This is so pretty.
Sniff
It
it.
is pretty.
I think the scent is really.
It is nice,
Yeah.
huh?
So are we
So
recording
yeah,
or?
so non-vaccinated families. This is our last slide. Just reminding people if you choose not to vaccinate, then you need to just adhere to those strict isolation requirements that we talked about.
Mhm.
The 21 days after your last date of exposure, um, and really protect those infants, pregnant ladies, elderly, and the immune compromised. And
Mhm.
we were talking earlier a little bit about what it means to be immune compromised, and pregnant women are immune compromised. People,
Cancer survivors.
cancer survivors, people with autoimmune disease, if you've got a diagnosis of something like diabetes,
Rheumatoid arthritis, even
that's right.
psoriasis,
Mm-hmm.
um, severe allergies.
That's right. Can all count as immune
Yeah, yeah.
compromised.
Um, are we missing anybody? Elderly? Well, we're more subject to the effects of mortality. Um, but a lot of people in my age group actually have had measles.
That's right. Okay. Well, I think that concludes.
I
Anything we
think
need to?
so. Well, I would just like to put the idea out there that we're here um, to answer any questions, to not to report anybody to the police for having no vaccines because that's stupid.
It is your choice.
Yeah,
Uh huh.
yeah, we free agency is how we operate. But we're here to support anybody who's worried about exposure, thinks they may have had an exposure,
Mm-hmm.
or knows they have an exposure, or becomes ill.
Regardless of your
Yeah,
vaccination status.
right. We are here for support and for questions, for visits, for bringing food and essentials to your door.
That's right.
And we'll
Okay.
get through this together.
That's right. All right. Happy Sunday.